He's not latching. I disown this child.
Get ready to laugh and hopefully learn something, because today we're reacting to medical scenes from American Dad. That's right, American Dad React number 3. Let's dive right in.
Hello, I'm Dr. Calgary. I see you are lesbians. Congratulations.
You can't even start a conversation that way. Don't walk into a room and assume anything. I've accidentally done this multiple times. I've walked into rooms saying, hey, is this your son? And it's actually their husband. It's a little bit awkward.
Just tell me I'm pregnant, Doc.
Wait, I hear a heartbeat. That is very uncommon in my office.
Wait a second, why does he say that it's uncommon in his office to hear a heartbeat? You can put your stethoscope on the abdomen of somebody who is pregnant and potentially hear a fetal heartbeat. But you gotta be careful because you might be hearing the patient's heartbeat because the aorta is right there in the abdomen.
And you are having an adult man.
I don't know why he's calling it an adult baby in there. We're using the right probe at least, but an ultrasound wave shows different densities, different black and white fine lines, different types of densities will show up differently.
Just let me grab my...
Oh! Whoa.
Roger, your eyes are bleeding!
The only time I actually typically see a lot of bleeding eyes is actually when somebody potentially has a really bad nosebleed. When you cry a lot, you also get a runny nose, and that's because all the tears go down through your tears ducts into the sinuses and comes out your nose.
The baby!
What? What's wrong with the baby?
Bleeding eyes means the baby's coming.
Normally, when somebody goes into labor, you start getting bad contractions in the abdomen. The amniotic sac ruptures and the fluid comes rushing out. When you are in labor and you have your partner or family member driving fast they can to the hospital, just be careful. You want to get there safely.
Stay strong,
Go, Roger.
Keep pushing.
Keep pushing.
Obviously not a sterile environment, but things happen. People deliver babies all the time in their house. It's okay, obviously. People do it. People have survived. Ideally, get the baby to the hospital just to make sure everything's okay and have the best optimal outcome.
He's here. Congratulations. It's a strange thing.
Why is he so small?
Babies come out all different sizes depending on how much time they've had to grow. And then if there's multiple in there, they actually are smaller.
What's wrong?
Oh, it's like one of those sponge dinosaurs. He'll get bigger once we add water. Hey, buddy.
Roger!
What?
My mouth is super juicy for
What?
this very purpose. Oh, give him here. I need to do skin-to-skin contact right away. He's not latching. I disown this child.
Skin to skin, it is good. It has to do with connectivity of parents to children. And then they're talking about latching. You wouldn't do that right away. At the beginning, there are some difficulties sometimes when children have difficulty latching onto the nipple.
So, new doctor. What kind of doctor are you?
No specialty. I can take your temperature, I can do CPR. Oh, and I've got a knee knocker.
All right, so what does that mean, no specialty? So a doctor could have no specialty. You have to do 1 year of residency, and then you can actually take a board exam to be a doctor, and then you're just a graduate of medical school, but without a specialty. But you can practice medicine, so I believe that's what they mean.
We're actually trying to help my dad access his empathy.
Yes, I think I can help. I'm trained in something called rapid eye movement therapy.
You do rapid eye movement, REM, when you get good sleep. That's like your dream state when you're actually sleeping. Oh my
Here it is.
gosh.
Empathy. That's a left, loop-de-loop, and up and down. One more loop, and a hang loose.
There are people out there that do hypnotherapy. It helps people get past PTSD, different things like that. It doesn't work on everybody. There are a lot of studies and evidence out there that people have had great success and feel much better after.
Knee knock.
What? The reflex hammer we use occasionally, you can use anything. You can even use the side of your hand to do like a little karate chop. But you're just hitting the tendon to make sure that there's a simple reflex from the tendon to the spinal cord and back.
Giving you a big, beautiful mine of hair is as easy as 1, 2, 3.
I can't do it. My head's under there.
What if I hold the other hand?
I'm a monster.
If you actually are starting to lose your hair and you're starting to go bald, definitely get to your doctor, check some basic levels. A lot of these things could potentially be fixed. Do you want me to do a full episode on what causes baldness or alopecia? Let me know in the comments below.
These hair seeds are gonna go nuclear when they touch down on that cue ball melon of yours.
He's using some type of therapy seeds. A lot of times you'll do a hair transplant. People take their own hair and transplant it up versus donor hair versus plug, so to speak. They don't really do those too much anymore. The alien is in the room. It wouldn't be in the operating room like that.
Let's gas this, Kojak.
I thought this was an outpatient surgery.
So outpatient surgery just means that you don't need to stay long-term overnight in the hospital. Typically when you have anesthesia for different procedures, you'll actually be induced with medicine in the IV first, and then you'll be controlled with your anesthesia by gas.
Stan, things are going very badly. Your body has rejected the hair seeds, and something went nuts with your kidneys.
This does happen. You get complications. You know all those forms that you sign before you go into a hospital or surgeries? It's to inform you that there are risks.
Fortunately, I already found the right person.
Prep for surgery. Let's get hairy.
Oh no!
This is a nightmare!
So in a hair transplant, there's no chopping off the top of your skull, okay? That is brain surgery, not a hair transplant.
Don't worry, baby girl. You'll be able to show your face again. All right, let's start by reshaping the old eyes. Tap, tap, tap.
Oh! You need to break the bones sometimes to reset it and move them. But yeah, you don't just go for the hammer first. You gotta open up the tissue, and he just did the infraorbital socket and the eye just popped out. What the heck?
No problem, just need to even it out. Easy.
No, the eyeball doesn't pop out like that. The eye is attached by multiple different muscles and nerves. There's 6 muscles to the eye plus the nerve in the back.
Well, might as well really get in there with a scalpel then, and there goes the face.
What? Why is he taking off the whole face? At least the structures underneath, you're seeing a lot of blood. So on the face, you're seeing a lot of blood vessels, you got nerves, and a lot of musculature.
You made me a monster!
Oh, it's not that bad.
What?
All you need is the right hat.
Oh my gosh. You actually see the black eyes on both sides. That's actually quite common. There's a bone called your laminate papricia, which can crack pretty easily. It'll be gone in a couple days. It'll reabsorb as it changes color.
I'm afraid Haley is in what we call a super coma.
No such thing as a super coma. It's just a coma. And actually, we don't typically call it a coma in the emergency departments. Somebody's just unresponsive.
At least she's not in any pain, right?
Oh, quite to the contrary. The only part of her brain that's still functioning are the pain receptors. Now, if you'll excuse me, I have to take a doctor poop in the doctor bathroom.
What? This whole idea that super agonizing pain, that's the only thing that they feel. Even if that's the case, you can give medications that actually sedate the person to where they don't feel anything.
The only thing Italian about this situation is your dirty lies.
What the? If the anatomy is similar in the neck of a human to an alien, I don't know. But in a human, you have your carotid artery and your jugular vein, 2 big hoses in the neck. You slice those open, you're gonna have some pretty bad cardiovascular effects. Everything will slow down, then you'll actually slowly die.
Just eat it.
Okay,
Oh,
but don't
no.
complain if I get pretty bad gas.
Oh man! It's pretty bad gas.
Stan!
Told you I get bad gas.
What is it?
Research has shown that about 90% of farts actually don't have a smell. You've all seen videos of people lighting farts on fire. You gotta be really careful. They actually can ignite and cause issues. There's a lot of hydrogens going on in there, so be careful. Don't do that.
Well, whatever's in there is
Wow.
off the charts toxic. It's gonna take at least a week to sanitize your house.
A week!
Wow, I've never seen that bad. The biggest thing we deal with, like gases that are horrible and bad, is carbon monoxide. It's odorless, tasteless, and you can't see it. That's why we have monitors in our house to be able to pick it up. You get flushed skin, you get bad headaches. So hopefully you'll be able to realize like I'm getting a bad headache, or other people in the house are all getting headaches, and get the heck out of there. I really enjoyed all of these clips from American Dad. Funny, medically relevant. I hope there's a lot more scenes that I can react to from American Dad in the future. If you guys like this video, check out the American Dad playlist right here, and you can also binge watch all of my Dr. ER reactions right here as well. Thank you so much for watching, and stay healthy, my friends.